Did you say you had bars?
I'm Randy Levicki. I do organizational.
Thank you all for coming. Thank you all for being a part of this experience. Without further ado, we're going to introduce Dr. Sam. Let's give her a round of applause.
Hello, good morning, everyone. Thank you for having me and for coming out so early in the morning to give feedback. It's much appreciated. I'm Dr. Samantha Scott, or Sam, Dr. Sam, just Sam. And I'm founder and CEO of JuneBrain, where our mission is to develop technologies that empower neurology patients and their doctors to monitor disease from home. So we have an awesome team. Again, Iris and James are here today. That includes myself. I have a PhD in biomedical engineering. My focus has always been neuroimaging and medical devices for the eyes and brain. We also have collaborators, include neurologists and optical imaging experts, as well as an awesome group of business advisors, including Iris, and our lead R&D engineer, James. So our disease of focus is multiple sclerosis, which is an often debilitating autoimmune disease that causes chronic inflammation, which damages both the brain and the retina. Around 1 million people in the U.S. have MS today, and 85% of these individuals have a form called a relapsing remitting MS, where their symptoms come and go unexpectedly to varying degrees of severity. Now, the main problem we have is that clinicians have neither the tools nor the time to monitor their patients more than a few times a year. This is primarily done with MRI exams, which are very sensitive, a very awesome imaging modality, but also very expensive, so they can only be covered for a few exams a year. So this is very important because early detection and treatment of new disease activity is crucial to slowing the progress of MS. And new disease activity can occur as often as on a weekly or monthly basis. So our solution is the NeuroEye, which is a wearable retinal imaging device, non-invasive, that patients use at home. And it works by detecting and reporting changes in retinal pathology that are associated with changes in the brain for MS. This also allows neurologists to more frequently and remotely monitor their patients. So the way the device works, the patient at home will wear the device, which is a headset, for less than 5 minutes once a week, and will acquire images of their retina. These images are then sent to a HIPAA-compliant cloud server remotely, and our algorithms will analyze the data and create summaries of what's going on with the patient. These summary reports will be sent to their physician on a biweekly or monthly basis, depending on how often they want the information. And the doctor can then use it to guide treatment decisions. For example, if they think the patient might be having an MS attack, they can come in sooner than they would have originally for a follow-up visit, or they can change their treatment if it seems like their current medication isn't working as well as they thought it would. And also, since MS patients are a very proactive community, the doctors can then send the information back to the patient to view on their mobile app. So there's benefits to a few different stakeholders, but primarily our target customers are MS patients and neurologists. So for MS patients, again, this can help slow their disease progression, accumulation of disability. It also helps them engage more often with their doctors, because a lot of patients experience changes in symptoms on a daily basis. So it's hard for them to know when they're having an MS attack, and a lot of them just keep this to themselves and try and manage it on their own. Also for neurologists, it provides objective data that they can use much more frequently to figure out what's going on with their patient and better care for them. So our business model is following a similar device, the CPAP sales model. So the way it would work, a clinician, a neurology clinic, would purchase 2 of the devices to keep in the clinic, when a patient comes along that might need to be monitored for a period of time, they'll gather baseline data in the clinic and train the patient on how to use the device. Then the doctor will give them a prescription to go home and lease the device for some period of time. So this will be covered by insurance. There's also the patient mobile app, and the clinician may have a mobile app that they can use to look at the data. And again, we're looking at different insurance options to cover the cost of everything. So this is just our overview of our timeline. So right now we're focused on prototype development. So we're very early stage, developing a proof of concept of the device in-house, and we received phase 1 funding to do this, as well as test in cadaver eyes from healthy individuals and MS patients. So after we have that proof of concept, proof of feasibility, we will apply for FDA approval as a 510(k) Class 2 device. And the goal is next year to receive approval and also begin human studies in MS patients over 1 or 2 year period. Our ultimate goal is product launch at the end of 2020. So to end on a positive note, we've done over 40 customer interviews with MS patients, neurologists, and other clinical staff, and they validated that this is in fact a true challenge, and having a device that provides more frequent monitoring would be potentially very helpful. So these are my 2 challenge questions where I wanted to pick everyone's brain. So the first one, something that's very important for our device is customer awareness, customer education, letting people know that you can monitor MS using the eye. So I'm wondering what kind of marketing activities we can do before product launch to increase this customer awareness. And also, if anyone sees any challenges or obstacles we might face, please share. That would be helpful. Thank you very much.
All right, everyone, I don't need a microphone, so don't worry about me with that. So now is our phase where we go into the question and answer section. I ask, excuse me, everyone to please state your name before you ask the question so that we know who you are, and it gets logged into the records for that, but also that you keep your questions brief and to the point. If we don't want to have a dissertation question like you see on Capitol Hill during a hearing. So, I usually like to start with the first question, but honestly, I got nothing at this moment. This is a wonderful concept. I can see the need, and I have some thoughts, but I want to hear from others first. So, who has a question after this the initial part of the presentation? Donnell.
So what type of marketing and advertising stuff do you do so far?
So the main one is probably through our customer interviews. So this includes just talking to as many MS patients as possible. And we've attended a few MS support group settings, and many of them have said that they're interested in kind of helping to promote the device once it's out there and if it works. So I think our first target is finding a patient ambassador to help kind of spread the word in their community. We also talk to the National MS Society, and they have a lot of very great programs for startups and small businesses to be active in the community. But I'm also trying to figure out the Twitter thing, which I think would be helpful once we get there.
Tim Quick here for Citizens Bank. I guess the question for me is that this touches a person that my aunt actually has MS. And for me, it's a very tight-knit community, and once you're in, you're kind of in, right? But the question I would have on that is, who is your client? I know end user is the actual patient, but conceptually in a product like this and the way your pricing model goes, the clinician is your client.
Yes.
You need the clinician to get to that. So I would really think about what route to go on. Like you're going after the patients, but the patient isn't your client, the clinician is. So you want to focus on the clinicians to make sure that they buy it. So you might want to look at the pricing model, because if you're charging both ends, you need the buy-in of the clinician for the clinician to push it, just like medical sales. So if you're looking in that perspective, make sure you don't overprice the clinician who's pushing your product before you get it as a necessity.
No, that's, thank you. And I know one of our biggest hurdles will be reimbursement,
Here too.
getting the device covered by insurance. But thank you.
David Hillison, Eagle Financial. I guess sort of two questions because you just touched on one of them. But the first is around CPAP. You referenced the fact that this will be a product similar to CPAP, a little different, right? Just in terms of what you're trying to accomplish. What sort of lessons or studies have you done around that model and how it's been built and grown? And then secondly, what can you sort of say about the likelihood of insurance reimbursement? At what levels? What sort of research have you done, around that as well?
Sure. So most of our research with CPAP has been around reimbursement and the reimbursement model that's accepted now and how they approve things. So what we were trying to do is follow that reimbursement pathway. So in terms of having a CPAP in clinic offices, which is done for sleep studies, then having patients lease to buy or buy the device to keep it home. So in terms of our device, we just finished, we had someone do a reimbursement assessment for us, which is very helpful. But what they found is CMS is now pushing this new set of codes for chronic illnesses, and a lot of it has to do with remote monitoring technology. So we're hoping that the hardware itself will be covered under there, so we'll have to apply for a new DME code to cover the hardware, which will be the lease price that the patient pays. But in terms of the physicians actually gathering the data, looking at it, and using it to make patient decisions, there are already codes that will cover that, which is awesome.
Laura?
So I would recommend to begin to make postings in Twitter and social media in general. Just begin to let other people about the disease. You can write facts. You can the goal should be you know what you're doing before you launch the product. So when the people know you about who you are, the knowledge that you have, then the people will be easy to buy.
I'm Chris. Oh, sorry. My concern a little bit is around your priorities. I wonder if you should focus on illustrating the product efficacy, which I saw in your timeline, and then that gets you the data to then talk to the providers who are the decision makers.
Sure. So one thing we're doing, our first real target are clinician researchers. So some of our collaborators, for example, the goal is to get as much data as possible from super early adopters who will be, they'll use the device in their clinical studies, for example. And that will help inform future neurologist customers on how to use the device, how it's helpful, how to use the information. So I think that's very helpful.
And your name, sir?
I'm Bill Saunders.
Okay.
Chris Inglis, CPA. So I have a couple ideas. First of all, the marketing. You need money to market, and so the main thing is you want to make sure that you're structured properly so you can get the right financing. So I'm sure you have tax advisors or financial advisors who are helping you structure the LLC or whatever it is to attract as much capital as you can. The second thing I was going to say is I think the model you need to follow is what the drug companies do, and that is they actually go into doctors' offices and they always have a pretty girl always when they go into doctor's offices typically. That's also a marketing strategy. But but basically what they do is they promote face-to-face sales and they convince the doctor that that's a product that they should be using and having their patients use. And so that entails a sales force, which entails capital, again. And the CPAP model is okay, but I think people can buy CPAPs without having a doctor monitor it. I don't know, are CPAPs being monitored by doctors? I don't even know. I don't have sleep apnea, but.
I think just the data. So the patients bring the data to their doctor visits.
Okay. All right, well that's kind of more customers, patient-centered. I think you should be more doctor-centered like the gentleman behind me said. That's it.
So first of all, thank you. After my career in pharmaceutical sales, I appreciate being called other.
Right.
I'm Andrew Goldman, and I guess a couple of questions. One, hopefully a really easy one. I'm sure working with VCs, you've probably already gotten some intellectual property protection. I just want to, while you're doing that, just to make sure if you haven't, have you? And the other more interesting question, I suppose, you're working with, you said the MS Society. Are you working with any other organizations of doctors or anything to start getting presentations together? I'm not sure whether in an education state, you want probably more presentations than going and trying to show a device that's.
Sure. So on the IFG side, we have a patent pending, non-provisional full patent pending on the technology. So we're trying to sort through that whole lump of stuff. And then on the physician side, we have our collaborators. So we're working with Hopkins and University of Maryland, but that's to get as much data as possible. But I have been wondering if it would be helpful to do more educational presentations. So with my former boss, I used to work, I worked as a part-time editor. So one thing my boss would do is put together these educational exhibits for drug companies pre-FDA approval, so they could only talk about the disease state. And he would present these at different conferences. I'm wondering if that might be helpful.
As you think about Dan Allen, Alec Solutions. As you think about marketing, I think it's helpful to break it down into sort of a life cycle perspective. One of the things I'm not clear on is, have you established efficacy in your testing process today, or are you trying to get participation in that assessment? Where are you on that stage of things?
We haven't established efficacy yet, so we're slowly building a functional prototype right now, and then we'll test safety and repeatability of the results, and then we'll move into human studies for efficacy.
So the reason that sort of inflection point is important is because pre-efficacy, you're targeting a different market of participants than post. Once you've established efficacy, then you are pivoting towards getting people to recommend your product for adoption. Prior to that, they're not even going to listen. So I would think in terms of who do you want at what stage in your life cycle, okay? So pre-efficacy, you're looking for the more adventurous clinicians who are looking for something to do. Maybe research universities are, a good incubation platform for what you're doing, and they have funding that you don't have to provide to look at these things. So Hopkins and those types of medical institutions that are just trying to improve the science of medicine. Post-efficacy, then you just touched on it, is the clinicians and doctors have continuing education requirements. And so plugging into those venues where they go to stay smart, conferences, groups such as this, where they stay in touch with each other. I know they're out there. I have doctors in my family who do that. And they invest a significant amount of time and money in that continuing education. So understanding where those venues are and how the ones that are close and easy for you to use, that's great. And then I think once you sort of penetrate that, you're still going to have to deal with FDA approval, right, before you can get to this insurance thing. Reimbursement, I think that's longer tail, just because the government's involved, right? And the insurance companies aren't going to consider that until you get through your FDA approval, probably, right?
I think we can do it in parallel, but
Okay.
yeah, they won't issue the code until we have approval.
So I'm sure there's a segment of your target market, both on the medical side and on the patient side, that can afford the product ahead of being able to do insurance reimbursement. So think about those folks as your early adopters, post-efficacy, and plugging into those neurologists where personal experience, we had a neurological issue, and there were things out there that we pursued that were not covered by insurance because we could. Not everybody can do that, but near-term game is the more adoption you have, the more successful you're going to be at everything else you want to do downstream. So break it down into those phases, and then you kind of pivot your target market. And the last thing I would say is post-efficacy is when you probably want to engage someone who's a specialist in social media marketing to help you with that Twitter thing, you know, and LinkedIn and Facebook, and pushing your message to people who will respond to it. And all those platforms allow you to target those messages very, very precisely, fairly cost effectively as well.
Thank you.
Thank you.
So I'm going to step in. I get the right as moderator. The thought occurred to me, the device scans a specific condition in the eye to monitor the progression of the disease. Can you cross-purpose the device so that it monitors for both diabetes and for a couple of the other things that affect the eyes?
Yes, yep, so that's one thing we're very excited about. So the device it will be sensitive, but not as specific to MS. So there's a lot of different diseases that can be monitored with the retina. So one is Alzheimer's has been huge in the science journals recently, which we could gather that exact same data with our device. Another is opioid addiction, alcohol abuse, any substance abuse in general has shown changes in the retina. Traumatic brain injury, epilepsy is another one. And I think ultimately, which is the pie in the sky dream, it would be awesome to have healthy individuals use this who are at risk for developing some of these diseases.
Okay. With that said, then this is where my thought was leading with this. Your model using this, the CPAP, and don't throw anything at me who are your advisors, I think maybe the wrong model. The model that I think you should be using, because everything's portable these days, is the new EEG device. That's $99.
Right.
I've seen it in use. It was pushed through very quickly by the FDA for approval. It's only $99 for the patient, okay? But what happens is that now it's exactly what you what you described. What you're doing is they're buying a device that gets the software, and then they set it up and it sends the information to their doctor as frequently as they want. That, I think, might be your better pricing model, because the way you have it set up now, the doctor has to prescribe it. The doctor has to get authorization from the insurance. You have too many steps to recover money, okay? Plus, then the physicians are, you're going to, waiting for the physicians to get reimbursed and stuff like that. If you go to the portable device model, where it's just the general customers who are then sending the information to their physicians, it flips it. So now you have more devices in the hands of people.
Well, does this device need a prescription? It doesn't?
No.
Wow, that's
Doesn't
cool.
need a prescription.
That's
Because it's not affecting anything. It's not making any changes. It's not affecting the body. It's just monitoring.
But
Your
it's
device
still
is just monitoring.
But is it covered by insurance? Or?
I don't know if it's covered insurance, but there's ads for it all the time, everywhere now. I have a few friends of mine who are using it, and it's actually really kind of cool. It's just a little device they pull out of their pocket, they put their fingers down, and in about 30 seconds or so, it gives them their heart rate. Yes?
Okay, so I will interject a little bit on the science. I think that's awesome. I think there's a couple of limitations there. One, what you don't see behind there is the type of science that is in this device involves lasers and things like that. The FDA, as I've done 6 products, 6 companies and multiple FDA approvals, no way. It will require it will require 510K, absolutely, because even though it's considered as somewhat non-invasive, it's still taking measurements and whatnot using sophisticated equipment, and there are predicates out there like that, so we are gonna have to follow the same model,
Okay.
because otherwise it will, no, they'll shut us down. My experience tells me such.
Jen? And then Dave?
Jen Dalton, Brain Mirror. Thank you for that. That helped me not ask a dumb question. And the other question I had, when I go get my glasses checked, there's a ton of technology, obviously, in the eye doctor's office. Is the equipment something that you could have in an eye doctor's office that you also are getting scanned for? And is that another way to deploy it that you're thinking about?
So the foundation for our technology is already in those clinics.
Okay.
And it's used for retinal disease patients. But a couple of the problems. So the first one is, again, you're limited by how much insurance will cover. So you can only have those scans done a few times a year. If that. And the other problem is we're trying to help patients who are often low mobility, and even rural patients who aren't close to these neurology or ophthalmology centers, so they can still have data sent on a frequent basis to their doctors. But it is a very similar, it's the same technology.
Yeah.
in a lot of ways.
Dave?
On the whole CPAP model, there are two questions in my mind. One is, did CPAP wind up scaling down in cost as adoption increased, and do you expect the same for
Yes.
you? And the second one is the level of complexity of a CPAP versus the level of complexity of this going to have a bearing? Sorry, Dave Morrell, 4 steps ahead. Is that going to have a bearing on what the ultimate cost will wind up being for the users?
Yes, for the second question. So our device, again, includes a laser that's very expensive. So that really drives the cost of the device and makes it much higher than the CPAP.
So, one quick follow-on. What is the size of the CPAP audience versus the size of the MS audience?
Oh, I had those numbers. They just look
Rough.
like great. So there's our target MS audience is around 360,000. I think the CPAP number of CPAP users is sky high. It's much larger than MS. Sleep apnea is just a huge, huge problem.
Lisa Humes. Once you establish your approval, then going to the Medicare space is a big space for folks that are either disabled on Medicare or the geriatric population, whether it's brain trauma, a variety of different things. So working with insurance carriers in the Medicare space, once they adopt that, they promote for you as well, because they're all about health and wellness and they want to be able to do that. So working with those carriers who are, entrenched in that space, I would think would be a good partnership.
Move, and then, unless you had a comment about
I just want to add one more thing on the business model side, is one of the things that we're trying to be really specific on is staying within what's called the capital equipment cap. So that a physician can actually make a purchase even in a multi-practice situation, as long as the system is within a certain price threshold, and we're being really cognizant of that, so that they don't have to go through big bureaucracy to make a purchase of 2 or 3 or 4. So that's something that we're also being really careful about in our model of the price.
I'll move, and then Shay, and then Derek.
I'm sorry. I did watch everything through the live stream though. Yeah.
I didn't tell you that not to make you nervous.
I watched everything from the beginning. Yeah, and I got to see it, and I got to hear everyone's interest too. So to answer or to kind of ask a question about your challenge question, following on to what Lisa said, are there organizations at your stage right now that are really excited about JuneBrain, who would be, willing or want to share your journey as it is right now and kind of help you reach more people? It doesn't necessarily have to be in the MS world either, but in business organizations or
That's true.
also in the science field is awesome as well.
I know one of our collaborators, I'm secretly trying to get to be our clinical ambassador. He is a neurologist with MS patients. He's an MS specialist. But that, I hadn't thought about that. Thank you.
Shay, and then Barry.
Sure. So your subscription model was like, the option is to subscribe monthly, use it 5 minutes per week. Are you charging by the minute? How are you limiting your patients from using it more than that? I mean, when you have a serious health condition, you can obsess sometimes, right? And then you're just constantly feeding your doctor information. They're getting like 50 alerts. So that's my first question, is like, how do you limit the use? Is it you have to sign in and you have like an allotted 5 minutes per week and like this is your day and this is your time? So how are you monitoring that and kind of controlling that? And the second question is, also if I have a device and I'm using it 5 minutes per week, obviously health is a huge concern, but I would prefer some kind of app where prescription-based potentially, because my phone can handle retinal technology, how can I download an app and just log into an app that can provide you the same information, the same data through that kind of model instead. So it's a device I already own, but then I'm, using their technology to help feed your data and information.
Sure, those are great questions. So the second one, there are a few different devices that latch onto your phone, and so those are more for to take just a general picture of your eye or even eye tracking. But what our technology does is actually break down the structure of your retina, which is where all of the information is. So it would be an awesome, that goes next to our pie in the sky dream. It would be awesome to have take our headset and actually have it as a mobile app or a mobile device hookup. But I think that technology is much farther down the road just because of the laser that's involved. So it's the first question.
It's just limiting, the
Sure.
use and the amount of time spent with the device.
So one thing that's very important, since we're using a laser, we have to have safety mechanisms built into the device to prevent the patient from using it more than the labeling says, for example, so more than once a week. So they won't be able to use a device more than once a week. But in terms of the app, so what the app does for the patient right now, and we're still tweaking out the app model, but what it's mainly used for is to remind the patient to use the device. They can send messages to their doctor the same way you would do with your patient portal. You can review summary reports that your doctor has sent back to you. So there won't be a way for them to constantly ping their doctor, because that's one piece of feedback we did here, was don't make the device a clinical nuisance. If too much is bad for them, and like you said, the patient, it can just increase anxiety. So I think that's what it's mainly to increase engagement between them, but not, overload the doctor with information.
Barry, and then we have one or two other questions.
For everybody in this room, I think you ought to understand this model very, very carefully and figure out how you're going to interface with it. Once this thing goes global, given the way that we can handle telecommunications, telehealth, telemedicine, the data management of all of that, and the way then that you figure out how to market and validate, you're going to be very busy. My question to you is, how big's your staff right now?
Here we are. We're very small at the moment, but our goal as we scale up is to support our business with more funding so we can start bringing on more talent. For example, a software developer. Eventually we'll have to have a sales team, a call center to deal with problems, but that's a little bit farther down the road.
Right there, and then Jen.
I think there was a lot of discussion, and I'd just like to summarize it. There's an ease of use question that you have, which is there's the eye doctor who has it in his office. Is there a kiosk option as you go into pilot? Is there then the home option, and is there then the mobile phone technology option? So it's like you've got to kind of have a look at that whole gradation of end device, I think.
Yeah, and someone suggested to us that we go into CVS's, for example, and just have every CVS have a device that a patient can go in and get data sent to their doctor. So we're very open to other business models.
Jen.
Jen Dalton with Brian Muir. Another crazy thought, and again, this might be a silly question, but Google employees have 20% of their allocated time to focus on a passion project. I wonder if you could identify who's worked on Google Glass or that type of technology that might be interested in dedicating time to partnering and collaborating. I know Google Glass is a different thing, but it's similar enough that there might be some free labor you could acquire. And I don't know about like Oculus Rift or any of the VR interfaces, but I've got to imagine that at some point that could be something that could also deliver that, especially with everyone, not everyone, my children, people I know wanting to get into VR. So, Facebook or Google might be interesting business partners if you don't find the individual specifically who's working on it. Just a thought.
David Hilson, sometimes the idea of marketing is to let people know about a problem they didn't know that they actually had, right? So, as I think about sort of the buzz around learning and data, and if you were in a mall or downtown somewhere and people saw people putting on these glasses for 5 minutes and they were getting, responses of things that they maybe didn't even know existed, all of a sudden you're creating some buzz around that. So, from a marketing standpoint, I think doing some, the idea of continuing education is great from a medical standpoint, but there's also something about marketing and buzz, that you need to create as well, and that may be one way to do that.
That is interesting. It reminds me of Mom was always talking about traction testing. So that just.
And our last question, right over here.
Angel went up from Wells Fargo. So to piggyback off his point from a marketing perspective, to get kind of people attracted to it, have you thought about attending any of the vision expos where a lot of the optometrists get in? So they have 2 a year, one that's on the East Coast and one that's on the West Coast. There's one coming up at the end of this month in Vegas, and that could be something where you can take like traction testing, where you can maybe take out like a sample model, show it to the optometrist, and kind of, there's over 50 people there, that's probably a short number, so that can help you get your marketing out a little bit more.
How did you know when that meeting was?
Well, my brother works in the optometrist field as well, so it's one of those. I went to the one in March in New York, and I'm going to go to the one in Vegas here in a few weeks. So that's something.
And to tag on to that, to close this out, there are also a lot of physician associations that do conferences annually and semi-annually. I know that there are 2 of them that are in Arlington, neurology organizations. If you haven't already reached out to those, that would be a wonderful place to start, because just having someone to speak about new technology, they're always looking for something new to talk about. So with that said, Dr. Sam, thank you. Donnell?
So, one last question. How can the 1 Million Cups community help you?
Well, this was already very helpful. My husband's taking notes, which is thank you. I think that the biggest thing that always helps us is learning about new resources that are available, because a lot of times we don't even know what we need until it's presented to us. So I think just networking and resources.
Wonderful.
I also want to add, one thing as far as, when you market to the heart. And when I mean by market to the heart is the